Agnosys Health is a frontline company that helps to bridge the gaps between physicians and their patients. So we do this by creating access and services that bring people closer to the right type of healthcare. We believe that the healthcare industry is so siloed that there's so many people within the country and even across the country that find it difficult to get the right type of care. And when it comes to like their data, access to their physician, even knowing what kind of care they need. And so at Agnosys, we help bridge this gap by creating products that help them know what you need as well as serving them. So this looks like our immune home product, which is where we go to their houses or wherever they find most convenient to provide vaccinations for adults as well as children. We also have our communities, and Agnosys communities are basically digital communities where people with similar traits or demographics can connect with a physician and find the help they need. So we have, for example, the Noisy Mom community led by Dr. Rena, where moms with young children can get direct access to a physician. And we have other similar products as well.
I would say number one major challenge on our table is the fear of unknown. And what I mean by that is having to go to a stranger's house, letting a stranger come into your house has been one of the mother's issues. So we get different kind of questions like, how am I supposed to trust you? How am I supposed to trust you with my house? How am I supposed to trust you with my child? And this type of question for how am I supposed to trust you with my child is coming from, let's say, a working mom that the nanny has to stay at home. So this has been one of our major challenge. And another challenge that I would say we have is mothers will want to be very sure of the type of vaccines you are giving. Are my children in the safe hands? Is my child safe with you? Are you getting your vaccines at the right place? Are they potent? Because you will get to know that some mothers are already ahead of us. Read, know what their child. So if you are not well nailed, know what you are doing, be good at your job, you might just flop. So the fear of, is my child getting the right vaccine, and the fear of letting strangers into their house has been one of our major challenges. And so far, we've been doing great. We've been doing well. Like I always tell some moms, I will tell you, try us, give us the first trial, and you will see. And our feedback so far has been good.
I belong to a group called Bet Safe. So it was one of my friends on the group that introduced Agnosys to me. Started off from where I wanted to take the 6 weeks immunization, and then there were different mommies saying that, oh, they always run temperature, and because I hadn't even recovered from the old trauma from childbirth and all that, so I said I'm not ready to go through any other trauma or anything that will make me feel bad for my baby. So while we were having that conversation, she then slid into my DM and told me that, oh, there are other options. I was like, oh, what was that? So she told me about Agnosys, and that was when I gave it a try, and since then it's been awesome.
Agnosys is a must-have partner for every mom. I mean, have you gone to a general hospital to get vaccine before? You will get there as early as 5 a.m. You take number and you would not leave until 2. Your entire day wasted sitting down, dancing and clapping just to get a vaccine, and you won't even get all the things that your child needs in the first place. So honestly, you guys have been very amazing. They will go to school to even give them vaccines sometimes. So even if I'm not there, they can just go to the school to give the child the vaccine, and that's it. Come to the house, literally just lying down waiting for them to come. I'm having meetings, I'm doing work, and they just come, check the weight, 5-10 minutes, done. And they actually helped me know all the vaccines that my child needed, as opposed to the short list that Nigeria currently gives. And it's actually very annoying, because I'm grateful that I found Agnosys, because I remember then they were not giving a lot of vaccines in the general hospital, but Agnosys spoke to me, taught me, said, okay, you need this. Only for years later, they're now giving those vaccines, and I'm like, my kids already got them because thanks to Agnosys. So a must-have partner for every mother who wants convenience, but not only convenience, actually giving your child everything that they need.
The idea of our older moms hiding so much from us, it added to everything for me because I didn't expect everything I saw. Is it the labor that my mom said you just close your eyes and open it and the baby will be by your side, and then you now realize that it's actually much more than that. And then the nursing part, oh my god, the first few weeks of I hardly had a good sleep. It was just crazy. So I think motherhood is actually a good one, but there are lots of challenges, there are lots of overwhelming period or stages that you will encounter, and it's really an overwhelming thing. So, but my mom would say that you have done it really well. And for me, I didn't have any help from 3 weeks. So it was really a lot. It was a lot.
Okay, so when it comes to motherhood and parenting, there are a lot of dimensions to think about when raising a human being. You think about the spiritual dimension, emotional, mental, physical, all of that. So I find that having a community part those dimensions really helps. So you want to be part of like groups that talk about all these different things. So like maybe like a group on health, a group on discipline, a group that covers physical activities, all those things. So finding that community, because it still takes a village to raise a child. It's just that the village no longer exists as it used to. So you must be intentional about finding that village and finding resources that sort of help you raise whole children.
Aside the fact that it takes off the stress of going to the health center, beyond that, the options of vaccines that you get using private vaccine center, Agnosys, is actually really good because you won't even get it at general hospitals. It wasn't when we wanted to take our 1 year vaccine, and my friend was like, oh, it's just bit A or something. Yeah, I can't remember now, but I hope I get it that it's bit A that I wanted to take. And I said, no, there are a lot. Why are you just taking bit A? He said, that's what they gave them at general hospital. So you can imagine that these are some of the things that other children will not get. And I advise every parent, if you can afford it, please go for it. Because when it comes to health related stuff, I'm always very particular about it, especially for my child. Because I'm also someone and one of the reasons why I don't even I would rather avoid it than to start to care for it. I would rather not allow that thing happen. It's because even for me, I always live on drugs for some certain things which could have been avoided. So I've said for my child, I'm just going to avoid everything possible just to ensure that she doesn't live on drugs or any medication and she's just fine. So yeah, I would recommend Agnosys, not just because of the convenience, but because of the options of vaccines that you get.
I'm very intentional about everything I do with my children, and I'm a logical woman. If there's no logical explanation for something, you can't get it to be done by me, especially to my children. I mean, they're my babies. I carry them, I birth them. I decide what goes inside them, what goes into their mouths, their eyes, their ears, everything. So I find that there's a lot of following, just doing things for doing sake. Okay, this is how we have always been doing it. Why? If you can't tell me why, it's not gonna be done. I mean, I'm not going to give my child, till now, my first is 5 and my second is 2. They've never tasted agbo before. Never. You will give me even my mother-in-law knows, don't even bother. I'm not going to give them because there's no explanation why should I give them, or teething soap, bath a child with a soap and you'll be calm. I don't know how a soap is going to soothe teething pain, so not going to be done. So you will fight a lot. That's why you need to have your own values as a mom.
The Soft Mama campaign is basically targeted towards the mom that we envision for Nigerian moms. We know that there's a lot of stressors, from traffic, financial stress, and even just worrying about your children and worrying about their health, things like that. Soft Mama mom is a mom that has ease and has the right type of help. So for example, a soft mama will, instead of going to a hospital to get vaccinations, we'll simply just call our line and have the vaccination brought to her. A soft mama mom, instead of going to a pediatrician to get help and consulting over a small issue, they'll just go online to our community and then they'll get the help that they need. A soft mama is a mom that doesn't have to go the hard way but goes the smart way.
Soft mama actually means, it depends on how you take it, but to me I feel like a soft mama is when you have to do things without stress. You have people that attend to your needs, your health needs, your domestic needs and all that, and it's not just being less free life, because I believe as a mother you have to be conscious of what you are doing. So being a soft mama, at the same time you have to be up there, know what you are doing, make sure your home is in safe hands, your child health is in safe hands. That makes you the round figure of a soft mama.
When it comes to caring for children at different stages will have different concerns, and depending on if you are a new mother or a mother who is a 5-star general, then the experience will be different. But in general, at every point in time, mothers are always concerned about their children having infections. And infections, thankfully, are usually very mild and self-limiting, such that we're dealing with simple viral infections like the common cold. However, sometimes even the common cold can get so severe that really young children stop eating properly. Another thing that I find that mothers are particularly concerned about is nutrition. So they're worried that their children aren't eating as well as they should, might not be gaining weight as well as they ought, but usually it's something that we can reassure the mothers about, to say that these children are just in a phase where they're not eating as much as they used to, and they're a little bit picky. But I assure you, if you try to give a variety, usually they do well. Immune Home, which is of course our product at Agnosys Care on Demand that caters to home vaccinations for mothers, was I think something that came as a result of the pandemic, where people couldn't come to the hospitals to get their vaccinations, and there were real, genuine concerns from mothers to say that, Dr. Rena, we can't come to the hospital, or we are afraid to come to the hospital. What can we do? And so we thought, why not? At Agnosys, we can come to you. And so in creating the vaccination process, first of all, we thought about safety, in which we could get our vaccines from the same places that the government hospitals that were trusted were getting their vaccines from. And that was the primary concern, to make sure that the vaccines were safely sourced. Also, we wanted to create a vaccination schedule that was in line with the National Program on Immunization. But we didn't stop there. We wanted to add a few other vaccines that were actually beneficial, but not necessarily on the National Program on Immunization, because again, these vaccines are sometimes quite expensive and are not covered under the national program. And so as a value-added service, we made sure that we added those to the vaccine schedule. We also thought about the actual process of administering the vaccines. So from booking to the payment to the service charge, to getting to the homes of the parents, to greeting them, to making sure that every vaccine that they're going to receive is explained to them, and the process of actually administration and follow-up. These were all the things that we considered, and what we did was that we spoke to a few mothers to say, what would you be looking for to make sure that this kind of service, what would you be looking for to give this service a 5-star? What things would you be looking to see this service provide for you to consider it a good, and convenient and even necessary service? And I think that was what we tried to implement. And the process of continuously improving the quality of our services is ongoing, and evaluation and monitoring is something that we take very seriously. And hopefully we are meeting and exceeding the expectations of our clients.
So at Agnosys, one of the primary things that we strive for is to make sure that every single person that we serve feels supported, feels safe, and feels seen. So we want to make sure that every time you have an encounter with an Agnosys staff or an Agnosys representative, you get that type of help, the right type of help that you need. So what that looks like within the Soft Mama campaign is making sure that moms get, for example, you can call our lines for support any type of support you need. After they receive vaccinations from us, we also have our nurses checking on them and support them in that way. So the primary goal for us and the way that we help moms is to make sure that they don't only get the service. Sometimes you go to the hospital and all you get is, oh, you need this and you need that. No, we take the time to explain the options that you have. We take the time to explain what each medication means and how it can help you as a mom.
I think it's a really exciting prospect because people always think that my constituency members, as I call the children that I always talk about on my page, are, my real constituency, but actually it's the moms that are my constituency. So actually, let me not leave out the dads. So it's the moms and dads that are my constituency members. I feel really privileged and really excited to be able to support moms in this way through the work that we do at Agnosys Care on Demand. And that's because the child is utterly and solely dependent on their parents for survival, for love, for care, for emotional support, and to grow into an adult that is adaptable and psychologically well adjusted. For us, in our own little way at Agnosys Care on Demand, to just make the lives of parents who are waking up at 4 a.m., doing school runs by 7 a.m., getting back at 10 p.m., to just say, if there's any day when you feel like I simply cannot go to the immunization center and I'll be at home, we'd be more than happy to just make your life just a little bit easier by bringing the vaccine to you at home. So yes, I think it's 5 thumbs up for Agnosys Care on Demand, and I'm really privileged to be able to do the work that I do with Agnosys Care on Demand.
I would say to moms across the country that they don't have to always stick to the traditional way of doing things. At Agnosys, we introduce digital platforms because it's an innovative way of making sure that they get exactly what they need, right? So one of the things that I would say to moms is like, you can always think outside of the box to get the help that you need. You can always think outside the traditional way that you receive support. Think about the ways that it can be innovated, and even within yourself, like help, domestic chores, things like that. Find easier ways and smarter ways to support yourself so that you're not burnt out and you can actually be there for your child.
Join the Soft Mama journey and let's bring the best care for your child to you. Visit our website today